everyone, I'm Insia Ali, a second year medical student at Himsr, and today I'm here with Dr. Nusrat Nabi ma'am to ask her a few questions about PCOS. So I would like to start by thanking ma'am for giving us time. Thank you so much, ma'am. So now my first question to you, ma'am, is what is PCOS?
Well, being a pharmacologist, we're not much into clinics, but yes, definitely PCOS is a very important term which young females of reproductive age group should be well versed with, because it is polycystic ovarian syndrome, and this has to do, it's an endocrine disorder, but in simple language it is about any imbalance with the hormones in the females of reproductive age group. And because of this imbalance, they have irregular menstrual periods. So that's the main problem with these females, which has many other implications also. So because of irregular periods, there is an ovulation, and so it can also result in infertility. It can result in difficulties in getting pregnant, and there are other many issues associated with it.
Okay, ma'am, what are the signs and symptoms of PCOS?
Well, signs and symptoms, as I already said, the main symptom is irregular menstrual periods, irregular bleeding. So it generally starts at the menarche, or it can also start, after you have had some normal periods. And generally, these females have, fewer menstrual periods in a year. And so irregular menstrual periods, fewer menstrual periods, and also sometimes prolonged duration of and anything which is not normal with the periods, which a female might have had during the menarche or the initial periods. So anything abnormal with the periods and fewer irregular periods are the main sign and symptoms. And then also because it is associated with increased androgens in the body, a male hormone within the body of females, which is also secreted by ovaries. So because of that increased levels of androgen, what happens in females, they have excess hair over the body. So centrally located hair on chest and abdomen, and also on face. So that is a very big issue for young females of reproductive age group. So this is called hirsutism. We call it hirsutism, facial hair. And then also these females have tendency. It's highly related to PCOS, obesity. So weight gain or obesity. Obesity is a risk factor, and then PCOS also results in weight gain. So they are closely related. Also another thing to mention is male pattern of baldness. That M-shaped baldness is also one of the symptoms of PCOS.
My next question to you is what causes PCOS and is it inherited?
Well, PCOS, it's generally the cause is not well known, but there are many theories and many hypotheses have been put forward, and there are many factors that are related to PCOS, and the most important of them is insulin resistance. As you know, insulin is one of the hormones produced by pancreas, and this is the hormone which is essential to regulate the blood levels in the body. So insulin resistance, when the body is not able to utilize the blood sugar in our body, so that is insulin resistance. So that has been closely associated with PCOS. Then next we also have, it has been seen that there is low grade inflammation in these women who have this PCOS. So their CRP levels, C-reactive protein levels, have been shown to be increased. So there is some kind of inflammation associated with these in these females. Then also, yes, hereditary. It is many researchers have also reported that it has a hereditary linkage. So that's also another. And last is excess androgens have been highly associated with PCOS, increased levels of androgens.
Ma'am, can lifestyle modifications help manage PCOS?
Yes, definitely. Lifestyle modifications have a great role to play in controlling the signs and symptoms of PCOS. Although they don't cure it, but they have a great impact. and especially weight reduction. It has been seen 5% weight reduction greatly increases the symptoms of PCOS, and it also helps the treatment, the pharmacological treatment that you're giving for PCOS. It complements it. It facilitates the action of the drugs that you're giving for PCOS. So yes, weight reduction is one of the most important lifestyle modifications. That is the backbone of treatment of PCOS. Then also a healthy diet, reducing your carbs and sugars is supposed to have great impact. Having a good protein and fiber diet, lot of fluids, and also lastly exercise, being active plays a major role. It has a great impact for PCOS. Although all over a healthy body, decrease of stress and increased activity is always advised for regulating your hormones. But for PCOS especially, a healthy lifestyle is it's the backbone of the treatment.
Ma'am, if you have PCOS, what are the other conditions you are at risk for?
Well, PCOS, as we know, it's a disease generally found in reproductive age group. So mainly you have irregular menstrual periods, and then because of anovulation, it's associated with difficulty in getting pregnant, and even infertility is also one of the major complications of PCOS. And then even if you are pregnant, then there are also increased chances of miscarriage, premature birth, then gestational diabetes, and pregnancy-induced blood pressure are also some of the complications of PCOS. So this is regarding pregnancy and pregnancy-related complications. But besides that, PCOS is highly associated with metabolic syndrome. Metabolic syndrome that would include, it is cluster of conditions including high blood pressure, high blood sugar, increased levels of your cholesterol, triglycerides, and which predisposes the patient to a risk of having heart disease and other blood vessel disease disorders. Then it also puts you at risk for type 2 diabetes per se, or pre-diabetes. And there are other conditions also that are associated with PCOS, like you have sleep apnea. That has been shown to be associated. It's one of the complications rather. It is associated and also one of the complications of PCOS. And then you also have depression, anxiety, and other eating disorders. And research has also shown that PCOS, one of the rare complications is also uterine lining, the endometrial lining cancers is also one of the complications of PCOS. So
can PCOS be cured, and what if it can be cured, then what are the treatments?
Well, cured, we still are in the process of learning more about the pathophysiology of PCOS, and we still don't know the mechanism behind PCOS. So we cannot cure it, it cannot be treated, but we can only control PCOS, control its signs and symptoms. We can control the symptoms, and so the treatment is mainly symptomatic, and also based upon the abnormalities that are used to diagnose PCOS, that what we know about. So, as we already discussed, lifestyle modifications are the backbone of the treatment of PCOS. They facilitate the pharmacological treatment, and in pharmacological treatment we generally have oral contraceptive pills, combination of estrogen and progesterone. Generally they are given, and we also have progesterone only pills can also be used for treatment of PCOS. There are many modalities of treatment available, and you have clomiphene, and you also have letrozole and other gonadotropins which are used. But metformin is one of the most important drugs that has been used. It's more commonly used, metformin, because metformin, as you already must be knowing, pharmacology.
Yes,
Yeah. So pharmacology, I always talk about pharmacology. So metformin is it helps reduce the insulin resistance. So while it reduces the insulin resistance, it has also been shown to have great impact on improving the symptoms of PCOS. So metformin is one of the mainstay treatments for PCOS. So there are many modalities, lifestyle modification, and then you have OCPs and metformin.
Is PCOS and PCOD same?
Well, it's a tricky question, and the definition is also, the definitions are also very overlapping. But just to simplify it, in PCOD, the ovaries release immature eggs, and these immature eggs then, they result in hormonal imbalance, and these eggs then result in formation of cysts around the ovary. They become swollen, and they are released and they surround the ovary. Whereas in PCOS, the polycystic ovarian syndrome, contrary to polycystic ovarian disease, in PCOS is actually per se an endocrine disorder. So there is already, abnormality.
Why do you think it's important to raise awareness about PCOS?
Well, raising awareness is important, as we have already discussed. It is a disease of reproductive age group. And as per the WHO data, we see that 8 to 13% of the global population of women in reproductive age group are suffering from PCOS. In India, we already mentioned about 5 to 22%. That's huge. And also important factor is that 70% of these women suffering from PCOS remain undiagnosed. They have these symptoms and they bear with these symptoms. They never go to the doctors, and they just keep on treating it at home with various home remedies. So they don't, and the consequences, as we have already discussed, is that infertility is one of the main issues. And besides infertility, there are other health concerns also associated with PCOS. Metabolic syndrome, like you have blood pressure issues, then your blood sugar issues, then there is complications like also you have association with diabetes, pre-diabetes. Then also emotional well-being is also associated with it, because when you have hirsutism, facial hair, so that's a matter of concern for young women. Male pattern of baldness, again, these are emotional things, aspects of this disease, where a woman is really emotionally upset about the complications of the disease. And also I forgot to mention, PCOS is also associated with NASH, liver, fatty liver. So again, all these things, all these complications make it important for us to know about PCOS, and definitely infertility being the most important concern. So it's the leading cause of infertility among women. So raising awareness is important. That's why I've agreed to talk about this, and I myself have got aware about this topic. So thank you for giving me this opportunity.
Thank you so much, ma'am, for for giving us your precious time and for educating us. I think I learned a lot from this, and I hope a lot of people learn from it. And we should all go and get checked for PCOS because it's so common.
Yes, irregular periods should always raise a concern, and definitely get yourself checked.
Thank you so much, ma'am. Thank you, Sej.